Now, for the gastric carcinoma, what are all the risk factors? Gastric का मतलब क्या होता है? What is gastric? Let me check what Roja is sleepy or awake. Roja, what is gastric? Gastric is which part? Esophagus, stomach, duodenum, jejunum, ileum. Which one is called gastric? Please punch your answer. Yes. I'm looking for your answer. Keep punching the answers. So I'm very happy that our first student Roja is able to ask questions. Asking questions is the most important thing in life, sister, that always the asking questions is the beginning of knowledge. That's very important. So when patient asks questions also, we should have a patience to listen to them, answer them, give a scientific answer, take away the fear in their mind. That is the whole purpose of a medical and a nursing team. Very good. Roja says stomach is gastric. Bahut badhiya. So Roja, you did not tell me you have done BSc nursing or diploma nursing. What have you done? Or MSc nursing. What is that you have done? So gastric carcinoma. Please punch your answer. So gastric carcinoma ka risk factors kya hota hai? So now remember, chronic gastritis or taking smoked food. Remember, in Japan, gastric cancer is very high because Japanese eat a lot that smoking noodles, right? So smoked food, very good. Roja, you have done diploma in nursing, very good, very good, very good. So smoked food is one important risk factor. That's the reason Japanese mein zyada hota hai, Chinese mein zyada hota hai gastric carcinoma. Smoking is a risk factor for gastric carcinoma. So you should remember this list, sister. What is this list? What lead to increased risk to get stomach cancer? Family history. Daddy ko hai, uncle ko hai, grandpa ko hai. Any food which is very high in salt or fat is a risk factor. There is a condition called familial polyposis. Polyp ka matlab hai any epithelium which is heaped up like this from the surface, that is called polyp. That is called polyp. Similarly, in the stomach you will have adenomas in few people. Gastric adenomas. Gastric adenomas. Helicobacter pylori infection is also a risk factor. There is an organism called Helicobacter pylori, right? That infection. Then in the past, if somebody has made a gastrectomy ka matlab, you have to cut the stomach. So what is the anatomy here? You have the esophagus, right? You have the esophagus. Then you have the stomach. Stomach becomes duodenum. Duodenum, that become the small intestine, which is called jejunum, right? Now, typically, if the stomach is being resected, then you are directly connecting duodenum with the remaining part of the stomach. So if you only take part of the stomach, that is called partial gastrectomy. It's called partial gastrectomy. If you remove the entire stomach, that is called total gastrectomy. So any past gastrectomy is a risk factor. Smoking is a risk factor. Meniere's disease, what is the meaning of it? Typically in Meniere's disease, the stomach, inside the stomach you are having epithelium and mucosa, right? So this become hyperplastic, means it will multiply severely and lot of multiple folds in the stomach will appear. That condition is called Meniere. That is also a risk factor. So, and what decreases the risk of stomach cancer? That is another favorite question of the examiner. Aspirin decreases the risk. And fresh fruits, fresh vegetables, vitamin C, they all decrease the risk of stomach cancer. You have to be very sure to remember for the tomorrow's exam. So be very sure, if a patient of stomach cancer dies, and you happen to do the autopsy, you have taken out his stomach. This is how this is all stomach, sister. In that you are having the mass, which is the stomach cancer. And you can also see the other appearance. You can see that the stomach is very much thickened and you are finding a lot of mass inside, which is basically a classical example of the stomach cancer, is what you have to remember. Now, Roja asks a very good question. Sir, what is the difference between pigtail catheterization and the central line? Beautiful question, beautiful question. See, pigtail catheter का मतलब क्या होता है? I will try to explain you right away. Yes, pigtail. Good question. Yes. See, you have the heart, right? Now, around the heart, you have something called pericardium. Pericardium. Pericardium say you are having fluid sometimes created. What is this fluid called as? Pericardial effusion. What is this called? Pericardial effusion. So, if this effusion become very severe, it will put pressure on the heart and the heart wall will collapse. Heart wall will collapse, and that is called tamponade. Tamponade. If the heart wall is collapsed because of a lot of fluid, pericardial effusion, then the heart cannot be able to pump the blood out. Obviously, only when the blood comes inside and if the ventricle is free to expand, then only the ventricle get filled and you can pump the blood into the aorta, right? Into the aorta. So, if you can't do that, then what will happen? The person goes into shock, right? So, in this kind of situations, what is the treatment? Obviously, you have to apply a catheter and you need to basically drain the fluid out. For that, what you use is a pigtail catheter. Pigtail catheter is what you need to basically remember, right? So, whereas central line is something that you are pushing something inside for a long period of time. So that is a fundamental difference between the two, right? Now, so I hope Roja is able to get the point.